afternoon. Assalamu alaikum. नमस्ते. अगर आप एक आदमी से बात करें उसकी ज़बान में तो वो बात उसके दिमाग तक जाती है, और अगर आप उसी आदमी के साथ बात करें उसकी अपनी ज़बान में तो वो उसके दिल तक जाती है. और Did you not understand what I said? Did you understand what I said? If you understood what I said, raise your hand. All right, we've got some Desis in the house. This is exactly what I want to talk to you about today. We make this mistake every day in our practices. We speak a different language. Our patients don't understand what we say. It should be the goal of every dental practitioner to discover the primary language of their patients and to adjust our conversations so that we make it easy for them to say yes. We at Guardian Dentistry Partners do justice in our practices. We use 4 simple questions to help us discover our patient's primary language and then translate our treatment presentation into that language. The 4 questions that we ask are, when considering dentistry, what do you value the most? Cosmetic, comfort, function, or longevity? And the second question is, when considering dentistry, what is your objection or concern? Time, fear, trust, budget, or maybe no sense of urgency? The third question that we use is, what is a quality that you appreciate in your dental professional? And the fourth question, my favorite question, is, are you a detail-oriented person or bottom line? Now, you may use some of these questions in some form in your practice, but maybe not all. You need all 4 questions to help you uncover your patient's primary language. And to help me illustrate this point of how these 4 questions will help us speak the same language, I'm going to use a sample patient. Someone we all know, Elijah Desmond. Are you in here? All right. Elijah Desmond presents to my office, let's say, for radiographic decay on tooth number 19, deep, with bone loss and some inflammation. Now, if I'm speaking to retired hygienist, gone serial entrepreneur Elijah, who answers maybe my 4 questions, he values longevity. His concern may be time, because he's running 4 conferences at the same time. Maybe the quality that he appreciates in a dentist is knowledgeable. But personality type, entrepreneur Elijah, might be bottom line. So obviously, my treatment presentation has to be to the point. Entrepreneur Elijah, tooth number 19, has 3 different options. We could either save the tooth with a guarded prognosis, or we could take the tooth out and do a bone graft and maybe do a bridge or an implant. I recommend that we take the tooth out, do a bone graft, and place an immediate implant. I've been doing this procedure for the last 15 years with great success. This is the treatment option that will not only last you the longest, but take the shortest amount of time for us to complete in the office. To the point, right? Now on this side, maybe we have a different Elijah. We have fun-loving rocket DJ Elijah, whose answers to my 4 questions may be like this. He values maybe cosmetics, cosmetic dentistry. His objection may be budget, let's say. And he's looking for a dentist that is trustworthy and caring. but he's detail-oriented. So obviously my presentation has to include a whole lot more detail. So DJ Elijah, tooth number 19 has several options with many pros and cons, which I can go over in much detail with you. We could either save the tooth by doing a root canal, build up in a crown, but you will probably need additional procedures like crown lengthening, post and core, scaling and root planing, all things that would add additional cost. Or we could take the tooth out and either do a bridge or an implant. I would recommend that we take the tooth out, do a bone graft, and place a beautiful implant. I think this will help you avoid procedures that may not last for a long time. I've been doing this for the last 15 years for patients just like you, and I promise I'll take great care of you. And my financial coordinator will help make sure that we make this fit your budget. DJ Elijah needs a whole lot more detail to build trust, and I can keep going. Same treatment plan, different languages. When you know the questions to ask, you know the language of presentation. Not only I, but my team speaks the same language too. When my financial coordinator presents to DJ Elijah, she goes into way more detail. She talks about the interest rate, payment options, payment amounts. But when she talks to Entrepreneur Elijah, she cuts straight to the chase. She knows what he needs. We all do. So our system is not just for doctors, it's for everyone to speak the same language so that our patients can understand, connect with us, and trust us. When we speak English to English, Chinese to Chinese, or Desi to Desi, we are not only speaking to the rational side of the brain, but also to the emotional side of the heart. And you need both to get your yes. This brings me to my opening statement, which was quite frankly a quote from Nelson Mandela in Urdu. When you talk to a man in a language he understands, it goes to his brain. But when you talk to him in his own language, it goes to his heart. We need to speak to both. Mastering the language of case acceptance with these 4 questions will help you get your yes. So give it a try and let me know how it goes. Thank you.